Oral exam question number 2, prompt number 4. Cardiac output is best demonstrated by the equation Q equals HR times SV. Explain how exercise manipulates each variable, discuss cardiac cycle and hemodynamics. So let's first talk about the structure of the heart and the blood flow of it. So first we have the superior inferior vena cava brings deoxygenated blood into the right atrium. Side note, this is the point of least pressure. Then 70% of this blood is going to be passively filled into the right ventricle. 30% of it, the rest of it, is going to be pushed and contracted into the right ventricle. Then it is going to be pushed into the pulmonary artery, where it is going to go to the lungs. It's going to collect oxygen, and then it is going to go into the left atrium by the pulmonary veins. It will then be pushed into the left ventricle, and then it will be contracted into the aorta towards the rest of the to the rest of the body, where oxygen will be supplied to muscles and tissues. The ventricle to the aorta, that is the highest point of pressure. So basically we go from atria to aorta to capillaries, which is where waste will be collected, and then it will go to venules, then veins, veins to where it goes back into collected, back into the right atrium, goes through the whole cycle again, where we keep going to the lungs to get oxygen and then pushing it through the aorta to go to the rest of the body, to the tissues and the muscles. So that is the pathway. Let's talk about the electricity. So when we, how do we push? How do we push that blood to the aorta, to the ventricle? We have a SA node, which is right on the top of the right atrium. So this sends depolarizing signals across both atrias, and it'll cause a contraction. It goes towards like a gradient, so it kind of goes out and then in. It kind of goes like a squish, which is why it kind of squishes the blood from the atria to the ventricle. It kind of squishes in. It only goes across both atriums because we have a dense cellular wall that separates the ventricles from the aortas, so that is why the signal only goes towards the top of the atrias. We have the AV node, which is in the septum in between them, which will then travel down the bundle branches to the Purkinje fibers, and that causes a opposite type of squish, where it goes in and then squishes out. It goes out and it pushes the blood through the either pulmonary artery or the aorta. It pushes it out. It's what gives it the pressure to push. That can be seen through a EKG or an ECG, German or American. If you look at the P wave, that is when the atria contracts or systole or depolarizes. The QRS complex is when the atria repolarizes or diastole or relaxes. The reason it's a big spike because that is also when the ventricle, which is bigger than the atria, that is when it depolarizes, systole, or contracts. The T wave is when the ventricle diastole, repolarization, relaxes. These words can be used interchangeably. It can be a little confusing, but we have those three: systole, depolarization, contraction; diastole, relaxation, repolarization. That can be seen through a EKG. So we have those basics down. Our equation: cardiac output equals heart rate times stroke volume. What does this mean? Well, peripheral nervous system, it is actually directly innervated by the SA node. Peripheral nervous system, peripheral, rest and digest. We already know this. So how does that relax the heart? The PNS, it controls the vagal nerve, the vagus nerve, and it it acts as a braking system on the SA node because it automatically fires at about 100 beats per minute, and that is not our resting heart rate. So it acts as a braking system, the PNS, on the SA node so that it gives us our resting heart rate, so it's not firing all the time. On the opposite side, we have the SNS, or the sympathetic nervous system, that is controlled by hormones, primarily epinephrine and norepinephrine. Those will cause an increase in calcium, an increase in the actin-myosin cross bridges, and an increase in the force of contractility. Where have we heard this before? In muscle contraction. The heart is a muscle. It's just involuntary. We don't think about it, it just contracts, but it acts the exact same way. We need calcium. We need the depolarization from the T-tubule to go to the sarcoplasmic reticulum, release calcium, binds to troponin, moves tropomyosin out of the way, reveals the actin binding site, myosin head binds to it. Inorganic phosphate and ADP causes the power stroke, and ATP comes in to release the myosin head, so we get the contraction of the sarcomeres. So, contractility. Side note, going into stroke volume. What is stroke volume? We have three components. We have preload, which basically means how much blood are we filling into the ventricles. This is primarily enforced by Frank Starling's law. That means the amount of blood that fills the ventricle, the amount of blood, the bigger the stretch, the bigger the contraction. So think of it like a water balloon. We fill the water balloon with a lot of water. Blood, the bigger the amount of water, the bigger the balloon is going to get, bigger the stretch. Well, once you have your water balloon and you throw it at somebody, it's going to have a larger pop because you have more stretch, you have more volume. Frank Starling law. Contractility. What's the force? What's the force we have to contract these electrical AV node, SA node? How hard do we have to contract this to get the blood pushed? And also afterload. Similar to contractility, but this is primarily at the highest point of pressure, right at the left ventricle to the aorta. How much force do we have to use to get the blood past the valve? Interestingly enough, the blood only flows one way. That's why we have valves. It's to reduce it to go backwards. It only moves one way. So think of it as though you are trying to push a door open, but someone else is on the other side of it. If they don't put a lot of pressure on the other side of the door, it's going to be easy to open. However, if they use 110% of their weight to block you from opening the door, it's going to be harder to open the door. It's going to be harder to push it through. That is just like the valve from the left ventricle to the aorta. We have to give enough pressure so that we can push through that pressure. That is afterload. So, to hemodynamics. Hemodynamics, primarily consisting of platelets and red blood cells. We have a few factors: pressure, flow, and resistance. How much do we have to, similar to the left ventricle, how much do we have to push against so that we can deliver the blood? We already got past the aorta. Now we still have to travel through the body. We still have, if we have high blood pressure, it's going to be constricted, it's going to be harder. We might have plaque in our arteries. We have to go against more resistance. So, a big thing is vasodilation. That is the reason why we get red when we exercise. Vasodilation, it's when you can see the blood in your skin, it gives you color. It makes it so much easier for blood to travel through. Vasodilation, that is the reason why we get it moving. So with exercise, obviously we need to increase cardiac output. You notice when we exercise, our heart rate increases. Noted. But it depends on what type of exercise we're doing. It depends on the type of exercise, it depends on the environment, it depends on our training age. How fit are we? Like, for example, if you are a very fit individual, you're an athlete, athletes normally have a lower heart rate. They have a lower heart rate while we're exercising. That's because they've adapted. They increase their vasodilation, and to contract it, they decrease their afterload. They have less pressure to fight against, more vasodilation. Or for the environment, say you're working in a hot, humid environment, our cardiac output is actually going to decrease. It's going to decrease because we're going to have low plasma volumes. We're going to have low hemodynamics because of low preload, because we're going to be sweating a lot. We're going to have less blood, less volume. Also, a note, even after we exercise, we have a decrease in peripheral nervous system because of vasodilation. That's why not when you're done exercising, you're immediately back to homeostasis. When you're done exercising, your heart is still beating very fast. You're still sweating. But because of vasodilation, it's because it inhibits the PNS. We can't stop the SA node from firing so fast. It inhibits it. Or say, for example, the type of exercise. Say we're doing a increased duration type of exercise. Our heart rate is going to be pumping fast, but actually our SV node, our stroke volume is going to decrease. Or say we're doing a type of anaerobic type of exercise, fast, quick. It's going to be just an increase in heart rate because of increased in hemoglobin, increased oxygen, we need it towards our blood, vasodilation, increased mitochondria. I think that's it. Thank you for coming to my TED Talk.